hands. This program that is offered by Dr. Brent James is known worldwide. Every year, physicians from around the world come to Salt Lake City to be trained in this advanced training program, and to be a graduate of that program is truly an indication of how much they care about quality and patient recovery and reducing patient harm. I'm delighted that Jay is a graduate of that program. He's currently the director of Intermountain Urological Institute and chairman of the Surgical Services Robotics Unit. These positions have allowed him to participate in real-time application of quality improvement and process improvement projects that have resulted in significant improvement in clinical care with subsequent cost and waste reduction. Dr. Bishoff, his postdoctoral fellowship was in laparoscopic oncology and kidney stone disease. His expertise and areas of research are in the latest minimally invasive oncology techniques, including robotic laparoscopy, cryotherapy, and radio frequency ablation. He's the editor of 5 different minimally invasive surgery textbooks and has also authored numerous book chapters and peer-reviewed articles. He's a graduate of the Uniformed Services University of the Health Science at Bethesda, Maryland, and an war veteran from Operation Iraqi Freedom. He completed his general surgery internship and residency in urology at Wilford Hall U.S. Air Force Base Medical Center, Lackland Air Force Base, and his endourology fellowship at Johns Hopkins Medical Center. As I was doing a little research on Jay, I found out that he's an author as well. So he's another underachiever like all of you who are here today with everything that he does. In 1991, Jay says, at the start of the first fall floor, I was a 4th-year medical student in Paris, France, on a general surgery rotation. Little did I know that 15 years later, as I cared for Iraqi civilians, military terrorists who would have killed us given the chance, the words of their Dr. Jean-Louis Hayek would echo in my mind. Patient care trumps politics every time. Every time. Under fire and under pressure in Baghdad, Iraq, Lieutenant Colonel J.T. Bishoff, the United States Air Force surgeon, gives first-hand account of the war in Iraq through unique photographic images and his personal encounters in his new book, Roots of War. I could go on and on about this in terms of how the hospital that he was working at the time was the busiest trauma center in the world. But that's not why he's here today. He's here today because Jay is a true visionary. He has been talking about this idea of how prescription medication addiction causes problems in our communities and around the world. Time magazine last month had on its cover, they're the most powerful painkillers ever invented, and they are creating the worst addiction crisis America has ever seen. Jay is here today to tell us how we can curb the suffering in our community by just taking some simple action and tell you about the magnitude of this problem. Please join me in welcoming Dr. Jay Bishoff.
I know you're thinking exactly what I'm thinking, which is he's been talking to my mom. I don't know where you got that. I'll have to talk to Caitlin and make sure we edit that down. You know, we're about the ATP course. It's this process improvement, and that's what really has made Intermountain Healthcare famous. And I was about 6 months ago, I was over at Brent James Park, the Key Bank building, and I was going to attend a meeting there, and I ran into one of the undersecretaries of health for the country of France. I lived there for a couple of years, so I greeted him in French, which was a great delight to him. And I basically said, "What are you doing here?" He said, "I'm learning how to change the healthcare system for France." He was here doing that. Well, I think what you're really thinking is all that stuff that John read about. What does it have anything in the world to do with narcotics, narcotic addiction, and how does a surgeon get involved in that? And it's one of those things that I'm sure you've experienced in your life, which is your life course takes you in a direction that you don't always anticipate for reasons that you could have never foreseen. So in 2008, I was recruited to come to Intermountain to be chief of urology by Charles Sorensen. Now, I came here about 6 months before my family came, and I wasn't sure they were going to come. We'd been very comfortably installed in San Antonio, Texas, and my wife wasn't sure if she wanted to come back to the winters of Utah, but nevertheless we came, and there was a delay. So I had a lot of free time that summer, and I saw every non-pornographic, non-vulgar movie that was in the theaters. And on one Saturday afternoon, I just happened to go into a movie called Happy Valley. I hope that at least some of you have seen this. And if you have teenagers or adolescents in your life for any reason, you can get this off Netflix and watch it with them. Because what this movie taught me is I'm sitting there unwittingly unaware of what I was about to experience, the social consequences of overprescribing prescription pain medication. And I was literally shocked and a little bit disgusted with myself as a surgeon prescribing narcotics just indiscriminately for any little condition and not knowing what the social consequences were. So literally that day in that theater, I grabbed a napkin with popcorn grease on it and sketched out a study. And as soon as I got back to work the next day on Monday, I called the resident. We sponsor a resident from the University of Utah, so we have a resident with us all the time. His name is Corey Bates. I said, Corey, we're going to do a study about how much we're overprescribing narcotics in urology. It's a really simple study. And then Corey ran off to do some research on the subject, and I went back to my clinical duties and responsibilities. I started gathering information about the scope of the problem. How big was this problem? And I really wanted to know to what extent was I contributing to this problem. What I very quickly found is that in this room, every single one of us is no less than one person away from someone whose life has been devastated by this problem. Many of you could stand up and give, if not all of you, give an example of a direct family member or one family member away from you who's had this problem, where it has reared its head and affected you in some way. So we started a research study really simple, and it was about how much do we overprescribe. So we sketched out the study and then off we went. What is the nature of the problem? Well, an average of 110 Americans die each day from drug overdose. 110 Americans die every day. 81 of those are going to die from a narcotic overdose. And most of those narcotic overdoses are from a prescription that they either legally obtained or someone they stole the narcotics from legally obtained. These are not from people going and forging prescriptions or buying them on the darker side of towns where you can buy prescription pain medication. So we also started to look at age-adjusted mortality rates for 100,000 people by year and cause of death. Now, in Utah, you cannot crash your car and not have that end up on the news. My neighbor's Camaro was stolen. You may have seen this. Last week, his Camaro was stolen out of his garage, and that ended up in a high-speed chase on 215 out by Clearfield, where the guy crashed his prized Camaro, SS Camaro, and of course, it was all over the news. So I'm not talking about crashing your car and dying. I'm talking about just crashing your car. But mortality rates for motor vehicle accidents are included. And mortality rates for narcotic prescription pain medication overdoses are included. And around 2000 is when this whole curve shifted. So if we look at what that means, it means that we have 16,000 deaths per year in the United States. Almost 500,000 ER visits just associated with this topic, whether somebody got injured or crashed their car because of narcotics or was overdosed and stopped breathing on and on. ER visits are amazing. And how big is the problem nationally? Well, this graph represents the drug overdose deaths in the United States, which have tripled since 1990. That's 3,600. In Utah, that's one a day on average, one a day. Just from prescription pain medication dies in Utah, one a day. But how big is the problem? We have statistics from the census as to how many grandparents are now raising their grandchildren. And this has also gone up proportionally since 1990. And so it's not fair, and grandparents know this, for them to have already raised their kids in a responsible manner, and their kids go off and do stupid things irresponsibly, including narcotic addiction, and the grandkids end up coming back to grandpa and grandma who are still responsible and are trying to raise yet another generation. So for every death, there are 10 people who come to treatment for abuse, 32 emergency room department visits for misuse or abuse, 130 people who abuse or are dependent, and 825 non-medical users. And one of the things that we found about narcotic prescriptions is it's really easy to measure the number of dead people from narcotics. Because you can actually go to the medical examiner's office and look at the charts and you pull them out, stack them up, and you can measure. So, okay, oh, there you go, you have about 360 every year. But what you cannot measure is the social consequences and the social cost of kids in rehab over and over again. Kids stealing money in narcotics, the conflict and emotional toil that this takes on families. And I see many of you nodding your heads in agreement that you have somehow experienced the pain of this. So in the nation, visits from opioids is in green, and visits with non-opioids is in brown on that graph. And so the problem with narcotics just continues to get bigger and bigger. This is overdose mortality by rates, and currently in Utah, we are the 5th in the nation. So it's a little bit better than it was 2 years ago, but we are 5th in the nation. That's how big the problem is. Now, it's not just the kids. This is a great article from this year's Wall Street Journal that shows that as the baby boomers get older, they are taking their addictions with them and they're converting it. So they used to smoke a lot of marijuana when they're younger, and now as they get older, they're converting that addiction into narcotic addiction. That's what this graph represents, and many of you probably saw this article. It was a huge 2-page article in the Wall Street Journal. So let's look at this statistic for a minute. This was published by the Associated Press in 2013. And we want to look at what is the change in per capita. Let's remind ourselves for just a minute what that per capita means. It means that we can take all of the narcotic prescriptions. These are legal prescriptions. These are not illegal prescriptions. All the legal prescriptions that were filled in the state of Utah, and we can calculate how many milligrams of narcotic does that represent per person in the state of Utah. Okay, that's per capita. In 2000, it was 48 milligrams per person in the state of Utah that was prescribed. And in 2010, it was 229 milligrams. That is a 300% increase per capita use. Now, that's a 10-year period of time. So are you going to tell me that somehow we did 300% more surgeries or dental procedures or podiatric procedures? No, we have a population that's just craving narcotics. And so we go to our doctors and we demand narcotics for back pain and headaches, and just the list goes on and on. And to the point is a 300% increase in prescription pain medication per capita. Now you're saying, wait a minute, in that 10 years, I didn't get any narcotics in that 10 years. I want my fair share. Well, that means if you didn't take narcotics in that 10-year period of time, somebody else took that equivalent to make it a per capita statistic. It's alarming. Here's how bad it is. This is a surprise to Americans. Americans, we constitute 5% of the world's population. That statistic already by itself is somewhat surprising to many Americans. But I want that later. I'll come back to it. We consume 80% of the world's opioid supply and 99% of the world's production pipeline. So you can't tell me that we have somehow special nerve systems, that we're hypersensitive to pain, but the people in other countries just aren't. We just simply have unrealistic expectations. Patients come to us for surgery, and they truly expect that it will not hurt. And as a laparoscopic surgeon, I take kidneys and prostates and major surgeries through 4 little holes on the abdomen. And when I was a resident, we used to have to cut you in half to take the kidney out. And now we do it laparoscopically. But patients complain about pain today, just like they did back in 1991 when we cut you in half and took your rib out. You'd think it was the same operation. We have an unrealistic expectation. When my wife was in Texas, she had 2 root canals and got ibuprofen. She came here to Utah and got a root canal, and the dentist came out with a prescription for 45 Vicodin tablets. She looked at the prescription and said, "What is this?" He said, "It's narcotics." She said, "I've had 2 root canals and I took ibuprofen. I'm not going to do this." And he said, "Well, you'd be the first." And looking at those statistics, I believe him.
What was the name of that dentist?
Always number 2 like that. You know who they are. This came out of this just a week ago. CNN reported heroin-related overdose deaths. And I put the little arrow there to And this article in CNN says the increase in heroin overdose deaths is a devastating price. Deaths from heroin overdose nearly quadrupled between 2002 and 2013 in Utah. We want to be known for economic growth. We want to be known for Lehigh's Silicon Slope. We want to be known for production and manufacturing. But we don't want to be known as leading the nation in heroin deaths. So what happens is the gateway drug today to heroin is prescription pain medication. And when you scavenge all the readily available sources of prescription narcotics, and you're deep in your addiction, that's when you go start buying heroin. And then you have to continue to escalate the dose to get the same effect. And that's what results in the death. So our hypothesis on this study that I sketched out in the movie theaters that we overprescribed, but we didn't really know exactly how much. And we're not here to talk about the study as much as what we found. And it was done at the University of Utah, and it was done at Intermountain Medical Center and LDS Hospital. That's where we did the study. It was a secret study. So that means Corey Bates and I were the only ones who knew about the study. But my partners in urology and his attendings at the university didn't know we were doing the study. So you would have urologic surgery at the university or the Intermountain facility, and about 2 weeks after, we'd simply call you and say, hey, how did we do with your pain control? Number one, so you did good. Actually, we did really well. Do you have any narcotics left over? How many did you get prescribed? And then what did you do with these narcotics? And that was what was very, very revealing. So we broke down the level of invasiveness of the surgical procedures we did. I can see some of the men are wincing already because there are many men in this room, John, of the urologic age. And that means that they have probably been to see us and that have maybe suffered some of these procedures. And some of them were minor, like we just looked at your bladder, which can be a little bit uncomfortable for some people. And then all the way up to major open surgery. And this is what we found. And the summary is on the end. We found that regardless of how many tablets we prescribed, patients always took less than 50%. So we were over-prescribing by 50%. And so we decided that we would stop doing that. And 84% of the patients were happy with their pain control, and there was no difference in satisfaction between what kind of surgery we did. We found out that a lot of the urologists gave you 32 Vicodin if you had a vasectomy. And if we took your kidney out through a big open incision, you got 32 Vicodin for that. So there's really no discrimination as to what to do. And that was the first study that had ever been done, as silly as that seems. It's such a simple study. It's very good science. No one had ever looked at this to say, how much should we prescribe if you have a knee replacement or an ACL repair? No one had looked at it. We were the first. And I just reviewed earlier, before I came here, an article being submitted to the Journal of OBGYN, and they're doing the same study. They're replicating our study now. We're seeing this in ENT, and everybody's replicating the study. So, and patients, only 9% asked for a refill, and only 2% asked for more than 2 refills, and that's the addicted patient. So what does this mean, though? Let's put some more numbers behind this and help us understand the scope of the problem, because some of you may say, well, who cares if Dr. Bishoff overprescribes by 50%? At least I had them there, and then they were there for me if I needed them. I didn't have to call late at night, et cetera, et cetera. I think that's a legitimate argument. But let's talk about the scope of what that means by me giving you 50% more than you need. We added up for that year we did our study, all the outpatient surgeries, about 90,000, all the inpatient surgeries, non-pediatric, this is not primary, this is just Intermountain. And that was another 33,000 surgeries. So if we use the non-used narcotic numbers from urology, and we extrapolate that to the other surgeries, just Intermountain Healthcare put 750,000 to 890,000 unused narcotic tablets in the cabinets of people in Utah. Now you add a couple of factors to that, and you can see how there are way too many unsecured narcotics out there. These are very conservative numbers. When we talked to our friends in trauma surgery and orthopedic surgery and told them we were prescribing like 30 or 45 for a major operation, they laughed at us because they routinely prescribe 50 or 60. Then in the day you could, which is up until this year, a refill. Here's 60 Vicodin, and here's a refill or two in case you need them. And then you add the university system, IASIS, all the other healthcare systems, and there are very easily 3 million unused narcotic tablets in the cabinets around the state. So my son's a good example. That's him. He does that back flip and the front flip when the wakeboard lands about 90% of the time. But he wasn't quite so lucky in the train park on the snowboard in 2009. He slipped, fell, and broke his pelvis on one of those obstacles. And he had pretty severe pelvic fracture. He got 60 Vicodin and 3 refills, and he used 12. But he kept the Vicodin in his bedroom until I confiscated them, because I was counting them. And then I was asking him if he was having pain. And for 3 consecutive nights, he told me he was just taking Motrin, but he wasn't. He was taking 2 Vicodin at night. When I quizzed him about it, he said he was taking them to help him sleep. See, even in my own house, with the knowledge I had a huge setup for a narcotic-addicted son right in my basement from his pelvic fracture. And I can tell you that had I not watched that movie and had I not done the study, very well could have just had access to all 60. Because I would have just assumed that everything was okay. And I would have assumed that he's one of those kids who's not going to get into addiction. And it simply doesn't exist. My nephew got 30 Vicodin for his laparoscopic cholecystectomy. He called me one day and said, "What do I do with the 23 I have left over?" This is a true story. I said, his name's Jared. I said, "Jared, if I were you, I would just keep them at home. Because you don't know if you're going to fall and break your pelvis in the train park this winter. And then you'll have those narcotics." And he said, this is a true story, he said, "Oh, Uncle Jay, I would never do that." He said, "You weren't here when this movie came out called Happy Valley. But that movie we had to watch when I was in high school. It's about how kids, in his words, get all jacked up taking prescription pain medication. He said, I already have some addictive behaviors. I'm afraid that I'll end up just like my 3 friends. One of them died of narcotic overdose in high school and go the same route. I really just called you. I didn't know how to dispose of these narcotics." So 92% of our patients didn't know how to dispose of them either. 7% said they were given instructions, but they didn't know what to do with them, so they just kept them at home. This is a huge impact on families. So here's what happens. And we know this from rehab. When the kids have a narcotic addiction problem, they end up in rehab. And there's a couple of great rehab centers here in Utah. Kids come from all over the world. Kids from the UAE and Saudi Arabia, they come here with their narcotic addiction to get help. So we become experts on this because we're so good at treating our own kids and people from other nations send their kids here. And what we find is this: what happens. We know that the heroin and stuff starts with narcotics, and they scavenge narcotics. And the stories that I'm going to tell you are the same stories, just get repeated over and over again. So you have a group of girls who have been dabbling in prescription pain medication, and then they run out. And they're 14, 15 years old, so you know what they start to do? Suddenly they want to do babysitting. Okay, so they get a little babysitting group together. They want to go babysitting, and they don't care about your kids, they care about what's in your cabinets. And as soon as they wave goodbye to you and you're out off to the movies or the dinner, they're going through your cabinets to get your narcotics. They don't take them all, they take part of them, so you don't notice so much. And then when they exhaust that supply, that's when the heroin stuff starts coming out. Then they often will start doing service. And we are a service-oriented community here, aren't we? Regardless of your race, your creed, your religion, we are service-oriented in Utah. So now these girls and sometimes the boys, they want to do service. Mr. Jones just had his knee replaced. We should go see him. And the parents already have this idea that there's something going on that's not pleasant, and they've got an uneasy feeling about their daughter or their son. But now there's somebody who wants to do service. Now, who's not going to embrace that? So we make cookies. We run them down to Mr. Jones. Mr. Jones is always in the living room. And the girls come in and say, "Hey, can I get you a glass of water?" Mr. Jones says, "No, that's okay." And they ignore it. They go into the kitchen. And they rub them through the cabinets because they're narcotics. And they take half. And if they're not there, then they say, "Hey, you mind if I use your restroom?" They run off to the bathroom and get those narcotics out of there. And they go to the extent of knowing who had surgery in the neighborhood and then going through the trash at night for a couple of weeks, just in case they did throw those narcotics in. When all that fails, they end up using heroin and prostituting and so many other things. And we know that because we talked to the kids who are in rehab here in Utah, and they all have the same story. And it doesn't matter whether they come from Michigan or California, you have that same story. We've done these same things to try and feed this non-satisfiable habit. So the consequences are significant. So what are we doing with this complex problem? We were kind of fighting it alone. Some of the legislators, Pat Jones and I, were fighting this. We had a couple of people on our side, just a lot of obstacles to it. And suddenly, over the past year, we've gotten together as an organized community about this. So what are we doing at Intermountain Healthcare is we have a narcotic stewardship program. So we give your narcotic prescribing report to all the physicians in your specialty. So we just recently shared that with the urologists, all the urologists who write prescriptions in our hospital. And the highest guy was writing 50 narcotic tablets for every surgery he did. And the lowest guy was me, 8. And I'm prescribing 8 narcotic tablets now for major surgery. Patients usually only take half of those because we're also giving them other non-narcotic prescription medication for pain. So they don't need the narcotics. So that's what we're doing. And we're seeing really quickly the numbers of narcotics being prescribed drop down. It's a complex problem. We're over-prescribing. Adults are over-consuming. There are multiple deaths every year from somebody who just doesn't follow the directions. The doctor said take 2 Vicodin and every 4 to 6 hours is needed for pain. They take 2 for their recent back surgery. Their back still hurts. They send their husband or wife down to the store to get something they like to eat. And they say, you know, my back still hurts. I'm going to take 2 more of these. These must not be very strong. And when they come back, they're sitting in a chair. They're blue. They haven't been breathing for about 30 to 40 minutes, and they're dead. So we want to take the prescription pain medication the way it's prescribed. And that happens all the time. Pharmacies don't until recently give instructions. So we've teamed up with all the pharmacies in Utah to give instructions. You'll see these blue boxes in all the Intermountain pharmacies in the state of Utah. They're take-back boxes. Do any of you know where the take-back boxes were before we put these in the pharmacy? The police station. Now, I'm a law-abiding citizen, and I don't want to go to the police station. So nobody does, and most of us don't even know where the police station is. You guys do, because you're very responsible citizens. The average person doesn't know. Now these boxes are there, and we're emptying these boxes once or twice a month for non-use prescription medication, and many of those are narcotics. The population in Utah, we're just simply not aware. We have anecdotal stories that we've heard of. We know of people who died of prescription pain medication. Nobody's really 100% certain exactly what was the nature of that. Where did it all come from? And that's one of the reasons we're giving these talks. This is the 63rd time I've given a talk like this to either PTA schools or groups like this. Narcotics are not secured. I cannot tell you how many people have come up to me and said, let me tell you a story. Here's my favorite story. 2 guys go to high school together. They marry girls from the same high school who are also friends, and they end up moving across the street from each other, raising their families. They've been that close for that long. Now they're both retired, and they just watch each other's house for each other, right? So one night, husband and wife have been fighting about where all of her narcotics were going, because she has chronic pain from back pain and fibromyalgia. And they've been fighting. It was a pretty bitter fight about where are all the narcotics going. She was blaming him. He was blaming her for not being a good steward of the chronic pain medication contract that she signed. And they decided to call the troops and go to Park City for dinner. They're on their way out the door. And the neighbor's out watering his lawn, best friend from high school, and says, hey, where are you guys going? So we're going to Park City. So are you going to spend the night? So well, we might. Depends on how dinner goes. And they kind of chuckled, and then they got in the car and drove away. But unbeknownst to his wife, the guy who was taking his wife to Park City had put some secret hidden cameras in his house because he was going to catch her. And he was going to come back and confront her. And so he went up to Park City for dinner, and the cameras were going to be rolling for a week or so. He's going to come back, and he thought, I'm just going to check the cameras. So he checks the cameras, and his best friend from high school, the guy who he's trusted everything in his life, comes across the street as soon as they leave the house. 5 minutes after they leave the house, rummaging through the cabinet, stealing his narcotics. The Baptists have a big group party over at their house. The narcotics are gone. The Catholic Relief Society has a bridge tournament, and one of the leaders of that has a thoracotomy for lung cancer. And when the bridge team leaves her house, all of her narcotics are gone, and she's on the phone calling saying, somebody stole my narcotics. The elders of the Mormon Church come over to the Relief Society for a big party, and when they leave, all the narcotics leave. It knows no race, religion, no boundaries. One of our pharmacists, his daughter had her 3rd molars taken out, wisdom teeth removed, had a bottle of narcotics in the bedroom, and 3 of her good friends from the neighborhood came over to visit her, 3 boys. And it was odd to the dad, a pharmacist in our facility, because these boys don't normally hang out at their house. He didn't know they were close enough, they'd come over and say, hey, I hope you're feeling well. And when those boys left, so did 3 boys in our house. So he was livid, and he went over and knocked on the doors of each of those boys' houses and said, somebody, one of these 3 boys has a narcotic problem and stole my daughter's narcotics. And one of the dads actually shoved him off the porch. The audacity of accusing his son of taking that gross narcotics. That was a Friday afternoon. Saturday morning, early, there was a knock on the door. There's one of the boys, tears in his eyes. There's one of the moms. There's the dad who shoved the pharmacist off the porch. Apologizing. Their son had severe narcotic addiction. They were on their way for inpatient rehab and then off to outpatient rehab. So he had the guts to call him out on, say, hey, this isn't right, somebody did this. And because he challenged him, he saved that man's life. We cannot ignore the social consequences of overprescribing. So if I overprescribe for you, you may be a good steward of your narcotics. And what that means is after you're done using them, you need to dispose of them. You can't have them laying around the house. The people who clean your house, the realtor who's showing your house, the neighbors, your best friend, for all you know, could be coming across the street for years stealing your narcotics. The stories just do not end. But here's my favorite. A vascular surgeon who lived and worked here in Utah said, listen, Jay, I've heard your talk twice now. I did not believe this was a problem. But most of you won't remember, I'm really tuned into this, but 3 years ago, just before Thanksgiving, there was a 13-year-old boy who died of narcotic overdose. And it hit the news because it's Thanksgiving. Most of these don't hit the news. That was my point about the traffic accidents. Crash your car, you're going to be in the news. Die of a narcotic overdose. You know, John went to live with his heavenly Father. That's how Paul says in the obituary. There's a 78% chance that in the obituary that person is 25 years of age or younger. In the Desert News Result, there's a 78% chance they die of a narcotic overdose. And they're not very clear about it. It's very rare that somebody's open about it. So that was the point about the crashing your car. So he says to me, look, I didn't believe this was a problem until the boy who died, the 13-year-old, was his neighbor, lived across the street, best friends with his son. They noticed that his wife, the vascular surgeon, had a hysterectomy. And not long after her hysterectomy, half of her Percocet tablets disappeared. So nobody in the house knew where they went. And then when the 13-year-old died, he had 80 Percocet tablets in his bedroom. He'd taken about 8 or 9 of them. He died of respiratory arrest. Some of those narcotics were his wife's narcotics, and they weren't secure. And he said, which is the thing I hate to hear the most, is I heard your talk over and over, but I didn't believe it was a big problem until my neighbor died. Isn't that sad? That list, that stack of charts is from the medical examiner's office, which represents 1 chart per day in the state of Utah, and all of those patients died of narcotic overdose. Shahab, how much time do we have?
We have another 11 minutes.
Our son Adam passed away on May 19th, 2009. He was 19, and he passed away from a heroin overdose. He loved building. He loved building from the time he was little. As soon as he got old enough to really be able to draw and do those kinds of things, it went from building and building blocks and all of those kinds of things to drawing floor plans. It was hard. We really knew very little about the seriousness of the drugs that he was taking. We knew that something was going on for several months, but we really did not expect it to be as serious as heroin.
I think the challenge for us with it is that it all happened so fast. You know, he graduated from high school, and then from what he tells us, he started using in October, and we didn't find out until a few months later, and then it was by May. I mean, it was just a matter of months, so we really don't have all of the story. We didn't have a prolonged months or years even of trying to deal with this situation. You know, it just happened so quickly, and he was gone so fast.
The conversation of, I only need a few more pills because the injury or the pain hasn't gone away, that's an okay conversation to have with a doctor. But a conversation about your son needing a test to prove that he's clean because he got addicted to drugs and maybe it came from a prescription drug to start with. After Adam's death, my daughter that's just younger than Adam came home one day. She was so upset. And she said, Mom, I had somebody walk up to me today and just say, hey, I've got a couple of pills they'll make you feel great, and they won't do anything to you. Do you want them? I just got them, they're free. His friend that introduced the heroin to him told him that he wouldn't be addicted. And that was the one thing that had him, when he would talk to me, that was the one thing that he would break down and cry about, was that that person lied to him.
So we have a complex problem, and how I'm really proud about Intermountain in the community. So we're attacking it from public awareness, like here today, prevention with the doctors, and talking to people, patient education brochures, provider prescription, treatment for narcotic addicts. Intermountain put up $3 million this year to help fund organizations, especially Davis County, which has one of the highest rates of prescription narcotic overdose deaths, to help with treatment. We're working with the legislature on policy. That's how we got those safe disposal boxes, and we had to change policy. Federal law paved the way for us to put those boxes somewhere other than a police station. Data surveillance and research, Intermountain's all over that. We're working with the criminal justice system, public awareness. You are very successful people, and we would ask you, please help us tackle this very complex problem. And there are some things you could do today. You could go to your homes today. You could get rid of all the extra narcotics in your house and just get rid of them out of there. You could ask your neighbors and friends to do the same thing. You could talk to your adult age parents, your grandchildren, and tell them about the same thing. There's so many things we can do. And we would just elicit your help in this very important effort and see if we can't push Utah down into the 50th state of narcotic overdose use, abuse, and deaths. Thank you for your time.
Prescribe more lines of pocket doctors. Is that incorrect?
So it is incorrect. Yeah, good. It's a really good question. Pharmacy reps are in our office all the time trying to get us to prescribe things, but not narcotics. So narcotics are so old that reps don't have to come and try and change our behavior. So that's not true. Except for the doctors who are illegally prescribing narcotics, you don't make any money prescribing narcotics. And in general, you don't make much money treating pain. There's just not a lot of money for pain. So that's a little bit of a misnomer. There are physicians who are sort of rogue physicians out there making money. So for $100, they'll give you a prescription for that. We're working with the DEA and the criminal justice system to shut them down. How do we do that? We know how many narcotic tablets any given doctor in now prescribes. And so it's hard to hide a narcotic prescription. So you have to have your DEA, right? It'd be easy to hide a Cipro prescription. But narcotics are very tightly controlled. That's why they call it a controlled substance. So at Intermountain, we run the numbers. How many narcotics are you prescribing compared to you? And if you're prescribing 10 times more than you, and you're in the same practice, there's a problem. And we're excited because if there are any Intermountain physicians or rogue physicians, we haven't found them yet. By shining the light on this, we're going to drive them away from their practice. But we know they're in the news all the time, right? Recently, there was a case up in Bountiful about overprescribing. It's been back in the news again. So that's a little bit of a misnomer. It's also a bit of a misnomer that patients forge prescriptions. That's actually quite rare. But now I hope you know why. I don't have to forge a prescription if I need narcotics. I just need to babysit at your house, right? Or I just need to come by and take care of your lawn while you go on vacation to Hawaii. Or I just need to come and visit you when you had your hip replacement because we're putting 3 million tablets out there every year. So I don't have to look very hard. Yes. There is, and doctors have I've worked at many, many different hospitals. In the Air Force for 24 years, worked at Johns Hopkins, 6 hospitals in San Antonio, and now here. And every hospital I've worked at has had a mechanism for you to come in and declare yourself addicted, and they work with you without penalties. The penalties come if you get discovered having an addiction, forging prescriptions, taking prescription pain medication, and you didn't come forward. And so it is a problem. It's not as big of a problem as we thought it was. And In the military, we had a rough idea of how much that was because you had to do random drug screening. So if you're a military physician, you did random drug tests just like all the other soldiers. And so we found out it's very, very low. Anesthesiologists have the highest problem because they have access to injectable narcotics all the time. And it's pretty easy to pretend you wasted 2 milligrams of fentanyl, but you really didn't. Yes.
When you tie in the medical profession, you tie it into the American Medical Association. So all these facts are out there within the country. How are you going to, let's say, change the culture if you're 50% in additional prescriptions? How are you going to cut that down to a reasonable amount if you don't have total organization to do that?
Yeah. So one of the things we found years ago is you don't have to wait for the AMA. It seems like they're a fairly slow, grinding organization. Reminds me a lot of the Air Force in the United States government. And so we didn't wait for them. And we published this article in the Journal of Urology. It was one of the most popular articles that they had in 2009. Everybody knows that this is a problem around the nation. But nobody had been taught and nobody had done a simple study to find out how many should be prescribed now. OB/GYNs doing it. The dermatologists are doing it for both surgery. Orthopedic surgeons are doing it for ACL, common things, knee replacement, hip replacement, ACL. And that's how we make traction. We also make traction by educating the population. So we want to educate you so that if your physician gives you 20 Vicodin, you don't go nuts on it. And when the patient perception of quality score comes, that you don't ding him on the patient perception of quality. So I tell my patients, I'm going to give you Tylenol. I need you to take it round the clock. I'm going to give you ibuprofen. I need you to take it round the clock for the next week. And I'm going to send you home with 8 dilaudid narcotic tablets. If you need more, call me. Call me, and I will get you more. But if you need more, there's probably a reason I need to see you in my office. And that's how we're doing it. We need to pay you as patients, me as patients, not to demand ridiculous amounts of narcotics. I don't know one that wouldn't be happy to see you back and find out why you're stealing. We have time for one more. Are we done? One more. Okay, quick one.
Great presentation. PowerPoint is available.
We can make it available electronically, and we have a recorded podcast also. I'll stay for a few minutes if you have other questions. Thank you.